I call it hospital in the community. We've been here for 50 years. We've thrived on self-determination. Our governance, which means that, this organisation is governed by an all Aboriginal board. Our senior executives and middle management are all Aboriginal. And this organisation is the first established Aboriginal community-controlled health organisation, and it was on the basis of two things. One was racism, and the other was because people couldn't access free or cheap medical services, and so that's how come this place was established. What I do then to flip all that is look at our burden of disease and try and provide services there. So that's what we've done. As I said earlier, it was 16 specialist services, and they're just run off their feet. So people are feeling more comfortable coming here and accepting their treatment plans and pathways rather than accessing the hospital system. And I think that's true to every Aboriginal health service in New South Wales. We only get funding once you're diagnosed with something. That's too late. When I look at our data, we've got, I think 0 to 9, we're well. And then from 9 to 15, 16, we're gradually becoming unwell. And then it's just a spiralling downward from there. Nigel Scullion came here and he said, "Oh, well, what do you want if you had a wish list?" And I said, "Well, I want to keep the well. And like we run a surf program. It's on volunteer basis, and we try and teach them healthy living, healthy lifestyle. We give them a healthy lunch and and plenty of activity, and hopefully that they will remember that and take it. And they're very sincere, and they'll always come back to the Aboriginal Medical Service. But yet the ideology of healthy lifestyle, they'd be waiting eagerly, 8 o'clock in the morning. They put in the hard yards too. They want to go ice skating too afterwards. And I thought, oh hell no, because I'd have to count all your fingers and toes and everything before and then on the way home. We'd have to do the same too. So I said, we'll think about that one.